was your reaction seeing it?
I hope he's okay. And knowing that can happen with concussion, it's alarming to see. But the simplistic explanation is you hit your head and it's like a blackout, like an electricity blackout. Boom, the power goes out, and you have that immediate posturing and kind of post-impact seizure. And then power comes back on and you regain normal functioning. And I think the story with him is went to the hospital just to get further evaluated imaging of his head and neck, which came back clear. So this was, in some respects, just a concussion. So thankfully it wasn't more bleeding, bruising, anything along those lines. But it's always alarming to see that. It can be all sports and even outside of sports. Fall down the stairs, get in a fight, martial arts, gym class, etc. So I still am a firm believer in the power and benefit of sport to help us with life lessons. So I never encourage avoiding sports because of fear of injuries, unless you've had pre-existing injuries or something like that. But we have had a lot of advancements with concussion that we've learned more and we've been able to take better care of it over the last 2 decades. The difficult part is that it's something that is self-reported. So we have to rely on the athletes to tell us how they're feeling. And unfortunately, athletes understand, hey, if I have a concussion, that means I'm going to be out. I don't want to be out, so maybe I'll keep my mouth shut. And so we work tirelessly on improving the culture around sport, getting coaches to encourage reporting, use injuries as a teachable moment, why this is okay to say something, and build support for those injured athletes rather than leaving them excluded. And I think the more everyone takes concussion seriously, the more reporting we get, and that is most helpful. We know that it takes adolescents longer to recover. So back when I was younger, concussion was no big deal and you got better in a week. And now we know that's totally false. Most adolescents, 70%-ish, can take up to a month to recover. But you think about that, that's 30%, almost a third that takes over a month. And we can't really predict who's going to land in what group. So I say, if you think there may be a concussion, and you can keep an eye as a coach, athletic trainer, parent, athlete looking at your teammates, if you see any of those signs, you report them, get them off the field right away. So immediate removal is key step number 1. When in doubt, hold them out. So there are times on the sideline that I'm not sure an athlete has a concussion, but we keep them out just in case, because things can evolve over the next hour or 2 and symptoms may worsen, and we want them on the sideline. And if you miss a game, that stinks, but it's much better to miss a game than go back in and have another injury. And then no one gets back while they're symptomatic, so they all need medical clearance. And that medical clearance in Wisconsin can be from athletic trainer, physician, advanced practice provider, but everyone needs to be checked out, hopefully by someone with an understanding of concussion. So the easy ones are, like you said, the ones that you can see, but that's probably less than 10%. So it's that big hit and they stumble getting up, or they stay down, or they're clutching their head or their helmet. Those are ones where we think, hey, this could be concussion, let's pull them off. It's not always concussion, but there's enough risk there. The other ones, and that's what kids get ingrained, is concussion is this big bad thing and I'm going to feel absolutely terrible. But most of them don't. It's you go, let's use football, helmet to helmet on the line, and you feel a little bit off and there's a little bit of a headache and, oh, but this isn't that bad, probably not concussion. But that's where they're wrong. That's where any kind of impact that changes how you feel, headache, nausea, dizziness, fogginess, there is risk that is concussion, come off right away. And it's the same thing afterwards. You don't have to constantly ask your child, oh my gosh, are you okay? Do you have a headache? It's just keep an eye on them, observe them, and if they're acting differently or reaching for the Tylenol or answering more slowly or more fatigued, those are signs where you start talking to them and digging in a little bit deeper. Yeah, our brains develop into our early to mid-20s. So the biggest concern that I have with younger athletes, if they lie or they get back in before they fully recovered, or even if they don't admit, hey, I got a concussion, I'm going to hide it for a little bit and just finish the final minute of this game. If you play on a concussion, it will take you longer to recover than if you came off right away. So if you came off right away, you may improve within a week, but even if you play 5 minutes and don't even hit your head, it's going to take you longer to recover. The other risk that we have is if you have a concussion, your brain is dysfunctional, right? It's not working well. And so then if you take another impact to the head on that dysfunctional brain, it becomes even more dysfunctional. And best case scenario, takes you longer to recover. Worst case scenario, you can see something called second impact syndrome, which is where people will get brain swelling, brain bleeds. These are all the terrible stories that we hear and read about, and thankfully are unusual, but they still happen across the country every year, and it's devastating because it's kids that die or have brain damage from that. So that immediate removal is the key. And then longer term, I expect everyone to really get better. So in terms of concussion, yes, it's a brain injury, throws off how your brain works. The thought is by resting appropriately, treating it and managing it well, not putting yourself at risk for repeat injury while you're recovering, that brain injury completely goes away and you can safely get back to full speed ahead. Once you are back to normal school and feeling good, then we talk sport. And there's great evidence that high school football does not increase risk of long-term like dementia or Lou Gehrig's disease or Parkinson's, and it doesn't increase risk of anxiety and depression long-term either. So when you compare those people to like band or professional athletes where there is risk, at the high school level, it doesn't look like there's risk with really good research behind that. But again, this is the key where you've got to get these kids to identify it, take care of it, and safely get back. I think the key is everyone needs medical care. They need to be looked at medically. And at the high school level, the school athletic trainer is very well trained to do that. Usually what I say, if they want to come into like our specialty clinic, I mean, people are welcome to come right away. But if you have symptoms that are going on for more than 10 days, or if you've had a history of previous concussions or longer recoveries, that's when I say, yes, we want to see those people in for sure. So if you've had symptoms for 2 days, you're probably in good hands with your primary care doc or your athletic trainer. But if it's going on longer, that's where that specialty experience is helpful, because there's other things that we can do that we see all the time that other people just don't see enough, and really help improve recovery. I know that's pretty vague, but